Hello friends, today I would be demonstrating a reduction maneuver employed to get the calcar beak out of the canal for reduction of an intertrochanteric fracture. Beak in signifies a negative anteromedial cortical reduction, which means that the anteromedial part of the head neck fragment lies within the canal of the distal fragment. This type of reduction has been shown to be an important predictor of failure in IT fractures. Patient is placed on a fracture table with opposite lower limb in lithotomy position. With gentle traction and mild external rotation of the lower limb, the fracture fragments are grossly aligned. C-arm comes in through the center, while the image monitors are placed at the foot end of the table. This technical trick is based on an article published by Dr. James Carr in Journal of Orthopedic Trauma in 2007 and also by Dr. Shiv Shankar sir way before 2007 in his teachings and various videos. The incision site for placement of cervical screws, which roughly coincides at the level of the lesser trochanter, is marked. A 2 to 3 cm incision is taken over the skin, splitting the IT band and the vastus lateralis. A bone hook is passed gently around the femur, taking care that its tip slides over the anterior bony surface of the femur to hook it around its medial surface. Bone hook is held by the assistant, giving a lateral force to distract the two major fragments. Then a 4.5 mm Steinmann pin is passed obliquely at the anterolateral aspect of proximal femur, where it passes safely through the tensor fascia lata muscle, roughly at an angle of 45 degrees to reach the bony anterolateral surface of the femur. Once the tip of the pin touches the bony surface, the C-arm is turned in lateral position to further guide the Steinmann pin ahead. With the assistant giving lateral force to the distal fragment, Steinmann pin is glided over the anterior surface of the proximal femur towards the medial side to enter the dip at the fracture site. Once the pin position within the fracture site is confirmed under fluoroscopy, it is gently pushed inside into the medulla in the proximal fragment. Gentle levering force of the Steinmann pin takes the beak of the proximal fragment, that is anteromedial cortical surface, out of negative reduction to achieve a positive cortical reduction. In these comparative X-rays, one can note how with lateral destructive forces of bone hook and Steinmann pin leverage, we can get the beak of the proximal fragment out from a negative reduction to a positive reduction. Once the fracture is reduced, the reduction is held with the lever of Steinmann pin and the fracture is fixed with two 2.5 mm K wires. The fracture should be fixed with minimum of 2 K wires. A third wire can also be added proximally. The first wire which we put is the lower wire, which engages the lower part of the calcar femoral. These wires can be passed through the incision for passage of cervical screws or can be passed percutaneously through intact skin. With alternating imaging in both AP and lateral views, these K wires are passed from the anterior aspect of the lateral femoral cortex, parallel to the anterior cortex, towards the medial side, engaging the medial calcar. It is beneficial for at least one of these K wires to be bicortical so that the fracture does not get distracted while we do reaming or passage of the nail. Once the position of these K wires is confirmed on imaging in both planes and we are satisfied with fracture reduction, the Steinmann pin is removed the bone hook is removed and we proceed with nailing of the proximal femur. These are final reduction images which show a well-aligned fracture with positive cortical reduction in AP view and neutral to slightly positive cortical reduction in lateral view. Next set of images shows that appropriately placed anterior K-wires do not interfere with nail passage or cervical fixation. This fracture was fixed with integrated screw mechanism nail with good alignment and good position of implants, being centrocenter in lateral view and inferocenter on AP view. We hope to achieve excellent result with this fixation. Thank you for your kind attention.